Morning, I'm Sully. I'm the Operations Manager at Carequality sponsoring this demo. Carequality is a national level consensus-built interoperability framework that enables exchange between and amongst health information networks. Carequality brings together diverse groups, such as electronic health record vendors, record locator service providers, and other types of existing networks to determine technical and policy agreements that enable exchange between platforms, networks, and geographies. Carequality provides essential elements for trusted national exchange in the form of common rules of the road, well-defined technical specifications, and a participant directory. In our demo today, you'll see a clinician utilizing an edge system, such as an EHR, is able to send and receive messages with an organization that is actually connected to a disparate network due to each network's participation in network-to-network exchange utilizing the Carequality framework and became implementers of the Carequality framework. The use cases that Carequality publishes are on the slides shown next to me, and others are continuously developed and published as time goes on. Push use cases include sending information to a public health registry or a cancer registry. Query or pull use cases include a clinician querying for vital patient information in order to efficiently treat the patient. You'll also see in this demo Carequality-based image exchange and a patient accessing her own information through an app of her choice. I'd like to proudly introduce Dr. Holly Miller and the rest of the crew to go through the demonstration today. Thank you.
How about a round of applause for our wonderful sponsor? My name is Dr. Holly Miller. I'm an internist and the Chief Medical Officer for MedAllies. In addition to what Sully already mentioned that we want you to look for in this demo, we also want you to be looking for the 360X closed-loop ambulatory referral. Our patient today is Carla. She's a 54-year-old single white woman with a history of breast cancer, first diagnosed 4 years ago. She was treated with lumpectomy and radiation and has been cancer-free since her treatment was completed. She has no additional medical problems. Carla uses the Invite Citizen app to track all of her medical records that she signed up for once she had her cancer diagnosis. She has already received 4 doses of COVID-19 vaccination, but recently, following a trip, she began feeling congested and coughing. In addition, she had some symptoms that predated those symptoms, and those were headaches and severe nausea. She's not sure exactly when she started feeling those, but with all of these symptoms, she has decided to schedule a visit with her primary care physician. At this point, we're going to turn it over to Malik at ECW, who will continue Carla's journey with the primary care physician at ECW.
Thank you, Dr. Miller. My name is Malik Curry, and I'm representing the Interfaces Department from eClinicalWorks. So Carla has booked her appointment with Dr. Mark Spencer, her PCP. Dr. Mark Spencer has his system set up to query CVS's data for Carla's information a day prior to her appointment. This is so he and his staff can be best prepared for the appointment at the time of the appointment the next day. We now pass it over to Kyle at CVS.
Thanks, Malik. Good morning. My name is Kyle Zumstein, and I'm a Senior Product Manager at CVS Health. I'm excited to share a new use case for CVS Health, where we will soon be a Carequality responder, and we'll be providing access to our immunizations data from our over 9,000 CVS pharmacy locations to any Carequality participant for purpose of use of treatment, payment, and operations. For this demo, our patient Carla has received the COVID shot, 3 boosters, and her flu shot from 3 different CVS locations. Historically, providers have not had easy access to this type of information, but we're changing that by aggregating our patients' clinical data in a secure, well-governed, FHIR-native data repository and sharing a comprehensive view of immunizations to any Carequality participant. With this information, physicians should be able to better address gaps in care and inform more comprehensive care plans. When Dr. Spencer sends the pre-visit query, we attempt to match Carla's demographics. If there is a match, we aggregate her immunizations into a continuity of care document and send it to Dr. Spencer's EHR for review. Now, I'll hand it back over to Malik at eClinicalWorks.
Thank you, Kyle. So as you can see in our right chart panel here, also known as our interactive clinical wizard, we can see her immunization history, including a flu shot and her 4 COVID vaccines. When Carla arrives for her visit, she complains of COVID-19 symptoms, so she's indeed tested for COVID. Unfortunately, she does test positive, and we document that here in our progress note. By documenting this into our progress note, this information will be shared through electronic case reporting to all participating public health agencies. Dr. Spencer then orders a course of Paxlovid to treat her COVID diagnosis. During her appointment, Carla also complains of persistent headache and nausea. She believes these symptoms began prior to her COVID-19 symptoms. So Dr. Mark Spencer would like to have this checked out due to her history of cancer. He orders a brain MRI and lets Carla know that she can follow up pending her results. I will now pass it over to Ted at Meditech.
My name is Gary Miller, and I'm a product manager at Meditech. Carla goes to a local Meditech hospital to get her MRI. Once the brain scan is performed, the radiologist reviews it and finds a brain lesion consistent with metastatic cancer. The radiologist enters these findings into the PACS system at the hospital, which transmits the results to the Meditech Expanse EHR. Carla's visit is completed, and a CDA document, including the findings, is made available for review by Carla's care team, including her primary care physician. The MRI image is also made available for sharing in the PACS system. And now I'll send it back to Malik from eClinicalWorks to continue Carla's care journey.
Thanks, Gary. And as we can see on our screen, we have indeed received the brain MRI report that Dr. Spencer has ordered. He sees that we do now have a brain lesion consistent with cancer. He utilizes 360X to now send out 2 referrals, one to an oncologist and one to a neurological surgeon for a brain biopsy. I'll now pass it over back to Dr. Miller at MedAllies.
This is an example of how clinicians using different networks will still receive the information required in real time. In this case, the primary care physician uses the ECW Direct network to send the 360X referral request. This is then delivered to the MedAllies Direct network, which transmit the referral to both the oncologist and neurosurgeon, who are both using the Epic electronic health record and the MedAllies Direct network, perfectly illustrating how networks operate. No matter the entry point the Edge system EHR uses, you get to the correct endpoint electronic health record. And now we're going to move over to Jack at Epic.
Thanks, Dr. Miller. This is Jack Hathaway with Epic here, and I'm going to be taking you through Carla's journey as we talk through the oncology specialist. Now, with here on the screen, thanks to the discrete data that we get with 360X, we can have this referral come into the system and automatically create a referral record. Then we can get it quickly triaged down to the front desk staff here so that we can get this open. They can see that they have a referral coming in. They're going to be able to then open that referral up, look at the clinical data that we get to see that, oh, yes, we can, and we really do want to take care of Carla here. So we want to let the PCP aware of that. So we're going to triage this here referral. We're going to accept it. And as we get it down here and accept that, and goes back to the PCP over at eClinicalWorks. So they're aware that we are going to be taking on Carla as a patient to make sure that she gets the care she needs. This is also going to send a ticket over to Carla's MyChart account so that she can get this scheduled as soon as possible to make sure that she's getting the care she needs with Dr. Allen. We're going to send this back over to Dr. Miller. Continue the story.
The accept response travels back from the Epic oncologist and neurosurgeon over both networks to eClinicalWorks primary care physician. Keep in mind, due to the 360X process and the efficiency of the oncologist and neurosurgeon's office staff, that 360X message is going back very rapidly without any faxing involved, all in an electronic fashion. And now, back to Malik at ECW in the PCP office.
Utilizing 360X technology, we have indeed received the accept status from Epic system, which traveled across the MedAllies Direct network and is viewable here on our referral screen in ECW. The referral coordinator, sees the accept status and schedules the follow-up appointment with Carla. We now pass it back to Dr. Miller at MedAllies.
The neurosurgeon staff receive and accept the referral. Thanks to 360X, the staff is able to rapidly schedule the appointment. The neurosurgeon then sees Carla and explains the need for the brain biopsy. They rapidly schedule and perform the brain biopsy at the Meditech hospital. Once the biopsy is completed and the pathology has been read, the neurosurgeon sends back the consult CCDA per 360X protocol to the ECW primary care physician who made the referral. Because it's not anticipated that the neurosurgeon will need to be involved in Carla's case any longer, this closes the 360X loop. And now we're going to go back to the Meditech hospital. Over to you, Gary.
Thank you, Dr. Miller. Continuing our patient's care journey, Carla undergoes a brain biopsy at the Meditech hospital. The biopsy shows conclusively that Carla's breast cancer has metastasized and spread to her brain. The biopsy report is finalized and made available for retrieval as part of a CDA document. Retrieval can be accomplished using the Carequality framework, ensuring that Carla's entire care team is able to review the biopsy results. And now I'll send it back to Jack and Epic to continue Carla's care journey at the oncologist's office.
Thanks, Gary. The critical information I got from the original 360 is referred from the first. We're pretty much good to go. But what we need now is that biopsy. And this is the other thing, so cool standards. With the standards, we can allow the system to automatically pull that information from the Meditech system in the background, so that by the time Carla arrives here with the nurse, all that information is ready to be reconciled. So we're jumping in as the nurse here, and we can see that we have that information taken from Meditech, so we can pull it into our system and make sure that it's here in the patient's chart. And then when Dr. Allen comes in, that chart there, you can see that we have the information from Meditech, and we have all the labs, we have the MRI report, and we also have the biopsy report over here. Now, with all this information, Dr. Allen really thinks that, she would like to see that MRI before she really talks about his treatment options with her. So we're going to work really good with us, who's going to show us how we can get that MRI image right here from within Epic. So with all that information in hand now, Dr. Allen's ready to talk with Carla about the various treatment options that are available, including the possibility of a gamma knife. So with all that information in hand, though, Carla is a bit overwhelmed. So she informs Dr. Allen she'd like to really take a week, take a step back to really think through her options. And also she wants to consult her citizen app from Invitae to really see what options are out there. With all of that, then Dr. Allen and Carla talk through where they want to meet up, and they decide on the following week to really finalize this. So over there, we can see that all that information is now in the chart. So this is where, again, 360X standards are shine, because we're able to sign this visit, and that goes back to my friend Malik over there with eClinicalWorks. So now the PCP is aware of all these conversations that Dr. Allen and Carl have had, and also that there's an appointment coming up the following week to really finish out the full treatment plan for Carla. We're gonna pass this back over to Gary to continue on with Carla's journey.
Unfortunately, the next day, Carla experiences a seizure and is rushed to the ED, where she is subsequently admitted to the hospital. There, she is stabilized using medications including Dilantin and a corticosteroid, and is subsequently discharged. So let me go ahead and discharge her from the hospital. At the time of discharge, a discharge notification is sent to her oncologist and her primary care physician, because the care team must be made aware when patients under their care are hospitalized. In this case, electronic discharge notifications using the Direct Trust framework are sent out to Carla's PCP and her oncologist. These notifications allow a patient's care team to improve care coordination and schedule follow-up care efficiently. They include the facility where care was provided, the date of discharge, and information about the care team involved at the hospital, as well as any reported diagnoses. Now I'm going to send it back to Dr. Miller to tell us more about discharge notification.
Thanks, Gary. Condition of participation discharge alerts will travel to the primary care physician and to the oncologist. The alert to the primary care physician travels from the Meditech over the MedAllies Direct Network to the eClinicalWorks Direct Network on to the primary care physician and ECW. Another example of critical information from one edge system across two networks to arrive at the destination electronic health record. The condition of participation discharge notification travels from the Meditech hospital over the MedAllies Direct Network to Epic to the oncologist. This is an example again of two different EHR edge systems using the same MedAllies Direct Network. And now we're going to go back to Jack to continue Carla's story.
And this is really where standards shine. We love our standards. With the message that we got here, it has metadata. And you can see we got it just at 10:44 here. Thanks, Gary, from Meditech. We got this with metadata. So the system is able to tell that this is an inpatient discharge notification for a patient that Dr. Allen is actively working with. This allows the Epic Hospital to create a routing framework to ensure that this message will go to her in-basket while keeping all those other messages that we kind of want out of there that the clinical team can take care of out of there. And now Dr. Allen's really able to focus on patient care. So we got Dr. Allen here looking at the message, and she does see that this is associated to the current cancer diagnosis. So we really want to make sure we can get that information. And again, thanks to the Carequality, we can now have her manually, before it was automated, this time she can now manually query Meditech's system to get that updated information. So then when Carla comes in the next week, she has all this information at hand, along with what Carla's going to be able to get with Invitae to really make sure they have that complete conversation. We're going to now pass this back to our friends over at eClinicalWorks with Malik to see what the PCP sees for their discharge notification.
Thanks, Jack. Dr. Spencer has received the discharge notification as it's dropped here in our patient documents area. If you wanted to view a more expansive or comprehensive report, we can travel to our Prisma Helo Insights area of eClinicalWorks. Here you can search by a keyword as is relevant to your patient, and you should be able to locate that CCD. As the seizure that Carla experienced is directly related to her brain tumor, Dr. Mark Spencer anticipates another 360 consult note. This note is pending Carla's follow-up appointment with her oncologist, Dr. Allen. We now send it over to Ben at Invitae.
Thanks for the introduction, Malik. We are now going to travel with Carla back home after her most recent care episode. Due to her previous breast cancer diagnosis, she joined the Citizen Patient Network. Upon joining, Carla was ID-proof to NIST Level 2, meaning her demographics were captured and her identity was verified by a third party. These validated demographics, along with her consent, enable Citizen to acquire her records on her behalf. The Citizen platform by Invitae is a free personal health record for any patient, but it has additional advanced services for patients with cancer and rare neurological disorders. An example of those services is the disease summary report. All of Carla's data has been reviewed by a clinician, and pertinent details related to her primary diagnosis of breast cancer have been extracted. This organization helps oncologists to review, and it also is helpful for researchers should they want to review Carla's record. In addition, all Carla's records are consolidated in one place. This helps Carla to manage her own care journey. The data that's stored includes structured documents like CCDAs, as well as unstructured text reports and PDFs. It also includes PACS integration. So Carla can even see her own high-res images. Today, Carla wants to acquire the new data that is being produced from her most recent care episode. We're going to click over to the Manage page. On the Manage page in the Citizen app, Carla can decide who she shares her data with. She can see who she shared with in the past, and she can see where her data has come from. I'm going to initiate a new query. This is an IAS query, or an Individual Access Services query. She can reach out to her provider systems without remembering or creating portal credentials. This demographic query is supported through the MedAllies Gateway. I'm going to let Dr. Miller describe what happens in the background.
Thank you, Ben. MedAllies operates both a direct network and a Carequality enabled network. In this transition, the query message from Invitae goes across the MedAllies Carequality enabled network to another network in the same framework and on to Meditech and ECW. ECW and Meditech respond with Carla's data to the query across the Carequality network to the MedAllies Carequality enabled network and on to be into the Invitae app. And now, Ben, back to you.
Thank you, Dr. Miller. The round trip that Dr. Miller describes happens in near real time. You can see here the data came in from ECW today, and it includes her Carla's most recent COVID-19 diagnosis, as well as the immunizations that were gathered from the CVS query. After the new documents have been received and added to Carla's record, her data goes through Invitae's machine learning, AI, and natural language processing functions, and then reviewed by a human clinician. The data is enhanced to research grade, and then based on her consent is exposed to researchers and principal investigators for eligibility to clinical trials or new treatments. After reviewing all her data, Carla is hopeful that the gamma knife and chemotherapy treatment option will work for her, and she's excited to follow up with her oncologist, Dr. Allen. Now back to Dr. Miller to wrap up.
So I just want to summarize what we hope you got out of this demo that really did hopefully illustrate next generation interoperability. So the first thing that we hope that you got was the primary care pre-visit query, which went to the pharmacy where Carla had, or pharmacies where Carla had gotten all of her immunizations. I'm a primary care physician, and I can tell you, generally, we're guessing, or the patient's guessing about the immunization dates, histories, etc. So this was incredibly exciting to see the ability for that immunization to come into the electronic health record. The next thing we hope you experienced was that push from the primary care physician once the COVID had been diagnosed to the public health registry. In addition, there was a push from the oncologist once Carla had her diagnosis to the oncology registry. Those were both over the Carequality networks. The next thing was our wonderful 360X referral from primary care to oncology and neurosurgery, greatly expediting the entire process of scheduling and Carla receiving the necessary care. You saw push messages over direct, you saw Carequality queries for critical missing information, and finally you saw a Carequality exchange of the MRI data over Nuance to the point where the oncologist was able to access in high resolution the entire MRI series through their own native Epic EHR. That was thanks to Nuance. And then the patient who clearly wants to have her information and be in control was able to access her Citizen Invitae app, which enabled her not only to retrieve the rest of her information, but really to discover the options of her treatment, which might have included or might include special studies that she might be eligible for her cancer treatment. So we hope you got that out of you. You've been an absolutely awesome audience, and we really appreciate your attending our demo today. Finally, we really want to give a warm thank you to our incredibly engaged and helpful sponsor, Carequality. And if you'd like to learn more about 360X, there's a URL there, or Carequality. In addition, please do scan your badge. Use the QR code in the corner if you want to get the text of this demo. And finally, please do feel free to stick around and ask us all questions. Thank you so much for your attention.